Francisco T. Duque III, and our Assistant Secretary for Health on the Public Health Service 2, Aztec Maria Rosario S. Bertero. Our Secretary of Health will now give his statement on the recent updates on COVID-19 health event.
Well, thank you very much, Dr. Meng. Once again, I'd like to welcome you to the DOH, our media partners. And I'm not sure if I need to read this out because this has been given in the press release yesterday. Did you get hold of this press release yesterday? Not all of you.
Because nakapost Viber group.
Oh, so nakapost it. Does everyone here have a copy? So I'll just read it lang, just for everyone's benefit, okay? So, the IATF, or the Interagency Task Force on Emerging Infectious Disease, headed of course by the DOH, has resolved to partially lift the travel restrictions to South Korea during the 9th Task Force meeting on the COVID-19 health situation. And following the 9th IATF meeting, Filipinos heading to South Korea except to North Gyeongsang Province, including Daegu City and Cheongdu County, will be allowed to travel provided that they sign a declaration signifying their knowledge and understanding of the risks involved. The IATF has also resolved to partially lift travel restrictions to South Korea as the government has implemented stringent infection control measures to contain the spread of COVID-19. South Korea has also reported a low case fatality rate of only 0.5%, and the successful containment of local transmission to only certain areas. The IATF also agreed to expand travel exemptions, allowing dependents and permanent residents in South Korea, Hong Kong, and Macau to travel to these areas as long as they also sign a risk acknowledgement declaration. Additionally, the task force approved the plan for the Department of Foreign Affairs to repatriate 148 overseas Filipinos from Macau, SAR, via chartered flight within the week, and for OWA, or Overseas Workers Welfare Administration, to repatriate 48 active OWA members via commercial flight. Returning OFs will undergo the prescribed screening and quarantine measures being implemented by the Philippine government. The EID is closely monitoring the spread of COVID-19 cases in other countries and is regularly updating its travel restrictions based on standardized risk assessment indicators. We are working non-stop to ensure that our kababayans are protected from COVID-19 no matter where they are. To date, we have not recorded any cases of local transmission of COVID-19 in the country. In fact, the WHO Director General has cited the Philippines as among the few countries in the world which have not recorded any new cases of COVID-19 for more than 2 weeks. In particular, 4 weeks na tayo na wala pa tayong nare-report. Wala tayong local transmission. With a whole of government and whole of society approach, we can sustain our gains in containing the spread of the disease. However, let me just underscore, as I have done before, the question is not if, it is when. The answer to when it is going to happen is something that we cannot answer at this point. However, despite our having been cited by the WHO as one of the few countries that has had successful containment measures, we cannot afford to let our guards down. Hindi po tayo pwedeng paluwagin ang ating pagbabantay, pagmamatsyag, pagbabuwardya para sigurado lang po na hindi makapasok ang COVID-19 sa Pilipinas at at hindi maging sanhi ng pagkalat sa ating mga komunidad. So ilan po ang ating update as of today. So malugod po akong sasagot sa inyong mga katanungan.
Okay, thank you po, Secretary of Health Francisco C. Duque III. Now we'll be having questions from the media. Ma'am Aika and then Ma'am Gerard.
Hello, Secretary. Good afternoon. Just like to get updates on the repatriation plan for those who are in Macau. So, kapag dumating po sila, are they going to be quarantined also in SCC or will they be advised to just be home quarantined because hindi naman po sila galing sa epicenters and malayo naman po yung cases like in Hong Kong?
Yeah. Well, yung pong ating repatriates from Macau will be treated as PUMs, persons under monitoring. In fact, in the IATF, meron ng kasunduan na siguraduhin ng ating Bureau of Quarantine na ang mga lugar na kung taga saan man itong mga repatriates ay bibigyan ng kopya yung listahan sa DILG at sila naman po may pag-ugnayan sa mga pamahalaan lokal na masiguradong binabantayan sila by way of daily monitoring for fever, for coughs and colds, and other symptoms of respiratory illness.
So, the hospitals po where they will, or I mean kung saan sila nakatira, will be alerted para po if ever magkaroon sila ng sintomas, they will be brought there for monitoring.
Tumpak po yung sinabi ninyo. Kasama po yan sa paghahanda na ginagawa ng ating mga LGUs. Yung ako po ay nakipag-ugnayan sa kanila, nagsalita po tayo sa kanila, pinaliwanag ang mga papel kailangan gampanan ng ating mga pamahalaan lokal para yung pag-activate ng kanilang BERTs, yung Barangay Emergency Health Response teams and systems. So kasama na po yan ang kanilang leveling up ng kanilang preparedness sa mga iba't ibang levels of response should there be a community transmission.
Secretary, hiwalay po ba yung repatriation for the 148 and 48 OWA members or sabay po sila that will...
Hiwalay. The OWA is arranging for a separate repatriation of 48 members.
May date.
We'll let you know, but there's been no definitive date.
Sir Gerard.
Sir, good afternoon, sir. Sir, yung with regards dun sa travel ban sa Iran, Italy, and another country. Japan, sir.
And Singapore.
Kamusta po yung usapan ng IATF no po dun?
Ang IATF matapos nabigyan ng health risk assessment results ng ating PWG ng DOH, ang naging pasya ay hindi natin sila isasama sa travel ban. Mukha as a medium risk lang sila. So, kumbaga, ang criteria, 5 pula out of 9, automatic magiging kasama ka sa travel ban. At syempre, hindi lang naman travel ban absolute lahat, meron din selective travel bans. So, depende sa situation. At marami tayong mga criteria na ginagamit para maging maliwanag ang yung objective basis ng ating travel ban recommendation to the IATF.
Sir, can you just confirm yung nag-stop daw po ang DFA ng giving visa on arrival to Iranians?
That was the report yesterday by Yusek Brigido Dulay. So, yes, I confirm that.
Sir, can you just get an elaboration? Ano po yung basis? Bakit po Iranian specific po ba? As in, Iranian nationals, hindi galing Iran?
DFA kasi ang nagbigay ng ganitong information. I will have to ask them kung ano yung naging basis. Ang alam ko lang ay dahil nga sa isa sila sa pinakamataas na case fatality rate at 7.3%. So nakakatakot ito. Mukhang very rapid ang transmission But we do not know whether the high case fatality rate is on account of weak surveillance na hindi nila nare-report ang tunay na bilang ng infected individuals. Pero nahuhuli naman nila yung mga nagkakaroon ng severe, if not critical conditions. And doon sa grupo na yun, doon yung mga may pumapanaw. So nakikita nila too late. So in other words, yung kanilang denominator maliit. Pero yung number of deaths mataas. Kaya ang case fatality rate mataas sa 7.3. In fact, they are an outlier. Because in China, the case fatality rate is about 3.84% in Hubei and in Wuhan, and about less than 1% outside of Hubei and Wuhan. In fact, most of the cases in 85% of cases in China is limited to Wuhan and Hubei province. 94%, okay, for the whole of China, yung reported cases. So mababa talaga. Outside of China, ibig sabihin, outside of Hubei and Wuhan, within China, okay, mababa pa rin compared to Iran. Iran is outlier, 7.3% siya.
Okay. Sir Jovic and Ma'am Tin.
So yung recommendation po ba ng IATF, wala pa rin at least ban on Iran with the cases that the CFR that we are seeing, or at least quarantine for the travelers who are coming from Iran?
As I've said, the IATF felt that the ban for Iran is not called for as of now. Okay? Kasi yung volume of travelers mababa. So yung risk of spread, risk of entering the Philippines of any infected case, mababa rin. So we leave it at that. But this is a day-to-day assessment that is happening, that the DOH is doing. So we cannot say whether tomorrow baka or on the next time we meet on Tuesday, baka magbago ang situation.
Yung sa Macau repatriation namin, sir, bakit kailangan hiwalay yung OFs and then yung OFWs sa flights? And same procedure din ba yung gagawin sa kanila na no one will be allowed to board if symptomatic sila?
Tama po ba? Wala. Nobody will be allowed to be repatriated if symptomatic.
Ma'am Tin, Sir JC, then Ma'am Shi.
Sir, updates lang po dun sa repatriate sa New York City, and kailan po yung send-off nila or makukomplete yung quarantine? And second question lang po, may kumakalat kasi on social media, po, fake news probably, pero ano siguro yung message sa public? It's a photo of a Chinese man na sinasabi na may lookout bulletin daw, yung Bureau of Immigration kasi nakatakas daw from Wuhan, tas in the Philippines right now. So may mga ganong kumakalat po ngayon. Anong gusto niyo sabihin sa public about that?
Well, these are unvalidated, unsubstantiated reports. So, pwede lang wag po tayong magpagamit. Nakikiusap po ako sa ating mga kababayan na wag po kayong magiging kasangkapan ng pagpapalawig ng mga peking, mga balita, mga unverified pieces of information ay wala pong itutulot ng kabutihan ito. Kahit na saan angulo po natin tignan, talagang walang kabutihan, itutulot ito, bagkos magkakaroon lang ng pangamba, takot, na hindi po natin yan kinakailangan sa mga ganitong panahon. Na tama tayo po ay dapat magkaisa at atin po siguraduhin na lahat ng balita ay manggagaling po sa mga kapani-paniwalang mga lugar katulad ng Department of Health at ang World Health Organization. Huwag na po kayo pumulot ng iba pang mga balita kung saan. Kung meron man kayong mga tukso na gusto ninyong kating-kating na kayo na mag-text ng mga fake news, no? Unang tanong sa inyong mga sarili ay ganito po, kung inyo po mamarapatan. Tanungin niyo sarili, naghugas na ba ako ng kamay? Galing ako ng palikuran, ako ba'y naghugas na ng kamay? Kung naghugas ba ako ng aking kamay, inabot ba lang 20 seconds to? Nakapagdasal ba ako habang ako ay naghugas ng kamay? Yun ang muna natin gawin. Huwag yung magkalat tayo ng kung ano-ano. Ang dami natin mga responsibilidad bilang mga responsableng mga mamamayan. Yung paghuhugas ng kamay ay kinilala na yan sa buong mundo. Ng lahat ng mga nagpakadalubhasa, this is one of the most important preventive measures. Okay? So yan, tanongin, bago tayo magkalat, tanongin ang sarili natin, naghugas ba ako ng kamay? Galing ako ng toilet, nagbawas ako, diretso ba ako kumain? Okay? Yung mga simpleng mga bagay na ganito, huwag natin kakalimutan. So you also be the ones propagating this. Yung cup etiquette, may baong-bakong panyo. Oy, darling, nakalimutan ko yung panyo, hindi mo ako binigyan. Salamat dito sa panyo binigay mo. Butas itong panyo. Para pwede na rin. Diba? New Clark City, I'm sorry. Si Asek Rosette is the master of the New Clark City repatriates condition reporting.
So, yes, as of today, as we speak, we have 16. The total of those New Clark City repatriates for those who have experienced symptoms, yung nakaranas po ng mga simptomas ay ngayon po 16 na. Ngunit 15 na po sa kanila ay nakabalik na sa New Clark City dahil yung kanilang mga test, 15 na sa kanila ay nag-test negative at saka 15 rin po sa kanila ay wala nang nararamdamang simptomas. Meron lang po na dinala doon na bago yung pang 16th na ngayon ay inoobserbahan at kinuha na ng specimens.
Ano pong symptoms ng pang
Diarrhea.
Sir Casey and Ma'am Sheila.
The WHO warned of global shortage of medical equipment to fight COVID. How do we address this point in the Philippines?
Can you repeat the question?
The World Health Organization warned of global shortage of medical equipment to fight COVID. How do we address this point in the Philippines po?
Well, we have had the procurement we have processed the procurement of additional PPEs, personal protective equipment, through the Philippine International Trading Corporation, PITC. So, we are awaiting for the delivery of such PPEs. Because that's very important. In the containment of the COVID-19, PPEs are a priority. The testing chemicals, materials, reagents is also something that we have been pressing on. Because I have spoken to Director Celia Carlos of RITM, almost on a daily basis, I keep asking him, ano na yung nangyari dun sa pinag-procure natin, dumating na ba, So, pinapromise naman daw within this week darating. But at the same time, there is also notice that it's being said that there's a global shortage. And that's really a matter of fact. There's really a global shortage. But we have to just keep pressing on. So kulitin ng kulitin, araw-arawin ninyo. Yan ang aking utos. Sa mask, meron tayong ready na additional 400,000 N88 masks that will be delivered by PITC from the manufacturing company located in the Bataan Export Processing Zone. So they have committed to deliver 2 million N88 masks.
Sir, as of now,
Meron din tayong commitment from the development partners. They're sourcing out additional PPEs. and additional budget, of course, provided by Congress. We are awaiting the approval by the Committee on Appropriations. We have sent a letter about 2 weeks ago, but as you very well know, nagkaroon ng changes sa mga committee chairmanships ng House. So I have instructed that a follow-up letter be sent after I sign it because we need their approval. And also, this comes after the President has very readily approved a little over 2 billion peso budget for the procurement of PPEs.
As of now, sir, do we have enough budget to buy supplies po?
Yes, we have enough budget. I just received a guidance from the DBM during our cabinet meeting last Monday, and he has pointed out to us that we have about close to 530 million available budget of the DOH that we can use. In the meantime, that we are awaiting the 2+ billion peso approved by President Duterte, but which will need congressional nod. Okay, so we're awaiting that.
Next, last 4 questions, Ma'am Sheila, Ma'am of the Back, Mara, and then Ma'am.
Sir, update po dun sa mga natitirang Pinoy sa Parco. 72 pa sila na repatriate.
So si Asek, Richard.
Yes,
Yes, ma'am. Yung sa Japan, we had a total of 80 positive cases. So sa ngayon po, 40 na lang po yung naka-admit sa mga different facilities or hospitals sa Tokyo, tapos naka-recover ng 40. Among those 40 who have recovered, ang nakabalik na po dito sa ating bansa ay 21 na, and 19 are still waiting to be processed for repatriation.
Sir, yung sa budget na medyo tama, 530 million, puhugutin siya sa existing budget ng
Yes.
DOH.
Ito yung nakalagay na budget siya, parang generic other supplies nakalagay. Yung iba kasi hindi mo pwede yung hugutin dahil nakalagay vaccines, tapos drugs and medicines, gano'n. The third item, nakalagay for other supplies. Doon natin hugutin.
Sir, may idea kayo magkano na yung nagastos ng government for COVID response? Including repatriation sa mga PUIs, UN.
Siguro hindi naman pa ganoon kalaki pero that's a good question. I think we should start doing a tally of how much has been spent. No? But kasi yung, halimbawa, yung repatriation natin sa second group in New Clark City, ang Magsaysay Maritime Corporation, ang malaking gastos siya kasi aeroplano, sila nagbayad, pagkain, sila nagbayad, yung mga maliliit na mga bagay-bagay, toothbrush, sabon, gano'n. Sila lahat yan. Tayo ang gastos natin sa ospital. Yung mga teams natin, syempre, meron tayong mga nilikha na mga teams na mga mag-aasikaso on a rotating basis. These teams are a composite of doctors, nurses, nursing aides from the 5 different surrounding hospitals of Region 3. So, hindi ko lang alam kung magkano na gagastos nila. But it's a good information that I will have to get.
Last 2 questions, Ma'am at the Back, Mara, and then
Sir, may we ask for your comment lang? So, Kuwait announced new travel restrictions for several countries, including the Philippines. And starting March 8, Kuwait will require expatriates who visited the Philippines and 9 other countries to present proof that they are free of the novel coronavirus.
Meron na bang local translation sa Kuwait? Would you know if there is COVID in Kuwait? Wala ka. Can you find that out, Mel? Hindi pa yata kumpleto yung sinabi mo. Yeah. Kasi sinasabi nila, kailangan recognize or accredited daw yung testing facility sa Pilipinas bago nila tanggapin yung resulta. Tama ba? Andiyan ba? Wala.
with the second. Pero sa ganun po, ano po yung gagawin po natin in order to comply with that, kanilang requirement? Or are we planning to ask
That is
for
okay.
reconsideration?
Yeah, well, I think that's the call of DOLE. DOLE should guide us. It should be DOLE who should respond to that. But kasi nung pinadala sa akin yung text, message na gano'n na nga, ang sabi nila, tatanggapin lang nila yung resulta ng testing from an accredited facility. Sila daw mag-accredit. You know, there's only one testing center here, which is RITM. So, kailangan ba RITM lahat? Hindi natin kakayanin na kahit na walang symptoms, itetest mo lahat yan. Mauubos tayo dyan. Hindi pwede. So, that is impracticable. Yes.
Carolyn Bongkin po from CNN Philippines. So my first question is, clarify ko lang po yung number ng PUI. It's 39 today. Tama po ba?
Si ASEC, Jerry has the latest.
Yes, ma'am, it's 39 today.
Ma'am, yesterday po kasi on Tuesday morning, it was only 23 and now it's 39. Ano po yung nag-cause nung pag-akit ng number?
Yes, ma'am. Actually, yesterday it was 25 and now it's 39. And this is an aggregate of all of these patients under investigation that we are monitoring. So with this, we have 18 which came from our different regional offices that are being reported as our regular patients under investigation. And then there is this addition, 2 coming from our referral hospital for these NCC repatriates. And then there's this addition of 19 patients under investigation. These are persons who recently had a travel to both in South Korea, had training there, and they are now admitted in one of our referral facilities. So that brings us to a total of 39.
Just to follow up on the budget, sir. Yun pong ine-expect na PPE, ilan po ito and saan manggagaling?
The PPEs, ang ating basis for the 2 billion budget is 5,000 healthcare workers ang allocation. So at 1,500 multiplied by the 5,000, multiply mo by 90 days because we're looking at a 90-day containment measure, and actual case management by the hospitals, more than containment is really the hospital care, multiply by 3 shifts and you get about 2 billion. So 1.5 multiplied by 5,000, multiplied by 90 days, multiplied by 3 shifts, equals about 2 billion.
Currently po ba, ano ang ratio ng PPE to health workers?
Well, you have for health, kasi hindi pwedeng 24 hours, dapat, hindi pwedeng 8 hours, dapat continuous siya. 24/7. So time is 3 shifts. So 3 beses siya magpapalit per person. So, yung binigay ko kanina, yun ang sundin mo. Time is 90 days, 5,000. Time is 1,500 pesos. Time is 20 days. Time is 3 shifts.
Sir, last na lang po. Sir, currently po ba gaano karami na lang ba yung PPE stocks natin? I mean, at least for public hospitals.
I will have to check on that. I haven't asked. It's still sufficient, I am told.
Last question.
Sir, you mentioned we only have one testing center here in the Philippines for the coronavirus. It's the RITM, sir. Meron na rin po kasing batikos po dito sa Pilipinas, and actually even the US government is experiencing it, that we're not testing enough people. That's why some critics are saying wala nare-record daw po na local transmission or there are no new cases kasi perhaps we're not testing enough people for possible coronavirus kasi baka daw po some people are not showing the symptoms. So perhaps, sir, you can enlighten us if the criticism is fair po ba, and meron po ba tayong mga measures na ginagawa to eventually have testing centers like what South Korea is doing?
Well, we are now expanding our testing capacity. We have 5 subnational laboratories that are up for accreditation by RITM. These are one in Visayas, one in Mindanao, one in Northern Luzon, and another one in Metro Manila. So we will have 5. The Vicente Soto, the SPMC in Davao, then we have the Mount General Hospital, Northern Luzon, Plant Center in the NCR, on top of the RITM. The WHO team, specialists on accreditation of laboratories, is coming. I think they've already arrived, or they're already here. So they're going to help already set these capacities. Number 2, I have spoken to the ambassador of South Korea and also of Japan. Okay? And they have informed me that they have already the rapid diagnostic test kits. So iba kasi yan doon sa ginagamit natin sa RITM. Sa RITM, what we use is the chemical RNA primer that will require the machine known as RT-PCR, reverse transcriptase polymerase chain reaction. That's the machine that we need, that will do fingerprinting of the COVID-19. Now, this is a far more tedious testing procedure. It will take 24 to 48 hours before the results do come out. Okay? Now, the reason I've asked South Korea, because South Korea is also an outlier, because it is able to test 15,000 a day. I think some of you have read that South Korea, has tested people, by, such magnitudes. And so I asked them, is your testing kit, not to assail, not to challenge, but of course, I'm also a physician and a man of science. I asked them, what is the basis of your rapid diagnostic test? Has this been cleared by the WHO? Because the last thing I want to have is a rapid diagnostic test. Well, it might produce false negatives. Nakakatakot yun. I'll say negative ka, then I'll let you go out, then you're really positive. But I have a false sense of security. I let you go out. So I'm not going to just use an RDT that is not being vetted by a third party, a credible third party, who will say, yes, this particular rapid diagnostic test has passed stringent standards of quality, safety, of specificity, and sensitivity. So sabi ko sa kanila, you prove to me. If you have that, and if the WHO, I will even talk to the WHO, they can already vet that rapid diagnostic test, we will ask you to give us some of those RDTs. But absent a third-party vetting of that RDT, I'm sorry, mahirapan naman tayo. So Japan, I also asked them because they say they've developed a rapid diagnostic test. Eh tayo nga, meron din tayo scientists na meron na lumikha ng RDTs Pero sabi ko, padaanin niyo sa WHO. Parang there's a third party that's going to that. Because I don't want a false negative result. And also, I also don't want a false positive result. Kasi false positive, that means I'm going to take care of the patient kasi positive siya, correct? So gagastusan ko siya ng limited resources na negative naman pala. So hindi ganun kasimple yung mga testing, no? You have to be very, very exacting.
Sir, just one more follow-up, sir.
Yung mga nagbabatikos, walang ginagawa siguro makabuluhan at makabulugan sa kanilang mga buhay. So gaya na sinabi ko kanina, tanungin nila sarili nila, nagbugas na ba sila ng mga kamay nila? Yun lang ang pananggal natin sa mga batikosero. Hindi mo matatanggal ang batiko sa buong mundo. Di ba? Lahat naman yan meron. Di ba? So bawian natin ng makabuluhan, makatotohanan, mga kasagutan. At kayong mga taga-media, mga aming katuwang sa pagpapalawig ng mga tamang mga balita, ay siguro din ninyo. If baseless, let's stop at your end. Don't let it proceed.
Sir, by when po ma-accredit yung for other testing centers? Meron na po ba tayong target date? And then by when can people start going there po?
Meron timeline niya. In fact, sabi sa akin parang 8 weeks, pero sabi ko baka pwedeng 4 weeks lang. Kasi 8 weeks parang tagal ka. So, baka 4 weeks. So, susubukan. But of course, that's not the only limitation. The other limitation is the worldwide shortage. So, we're competing for the additional logistical support. But I hope that you also understand that between us and other countries that have already reported massive local transmission, syempre unahin yun. In the totem pole of priorities, medyo, but sabi ko, it's no excuse. Araw-arawin niyo, okay din yun. Sa makuha natin yung share natin.
Sir, can we have last 2 single questions?
Sure, of course.
Miss Aiko and then Sir.
Secretary, WHO is asked or encouraging countries to prepare and store po yung tinatawag na ventilators and hyperbaric chambers for the treatment daw po ng COVID-19. Do we have supplies or saan pong hospital meron tayong prepared for this po?
All our levels 2 and 3 hospitals have the capability to manage critical cases. So yun lang yun, so may respirators, may ventilators, yung hyperbaric chamber, hindi naman talaga proven yan that it helps. No? So what is important is we have the isolation rooms to observe, to assess PUIs, and early detection is the key. Let me repeat, early detection is the key. If you notice, inubo lang, kahit na walang lagnat sa NCC, nilalagyan na namin agad. Because the key is always early detection. You don't want people to slide down into the critical conditions. In China, we were told when I met with, when we had the high-level ministerial teleconferencing initiated by the WHO, last week lang, I think it was Friday last week. The reason nagkaroon ng upsurge sa China, they waited too long. 15 days meron ng symptoms, they were bringing them to the hospitals. So, ang dami. So, ang laki ng taas ng kanilang, relatively speaking, their case fatality rate. And because hindi ka agad dinadala sa hospital, hindi nagkaroon ng early detection and care, yung opportunity for spread also became high. So we're learning from all the other experiences, no, of China in particular. So how not to do things in some instances.
Last question, Sir.
Sir, yun doon tungkol sa Diamond Princess, sir. Yung mga, wala nang Pilipino doon, sir. Sa Diamond Princess Cruise.
Sa cruise ship. Crew member po.
Wala na po, sir. May naiwan, di ba, yung nagpaiwan po sila na isa na tao because they have to do essential tasks doon sa barko. 10 po sa kanila ngayon, monitor at isa po ay nadala po sa isang facility doon sa Tokyo dahil hindi related ito sa, yung mga naramdaman niya hindi related sa COVID-19. Pero wala na pong Pilipino sa loob ng barko na yun.
Okay. Yung pangalawa po, sir, Secretary. Sir, masasabi ba natin RITM certified ng World Health Organization?
Oh, yes. That means,
So, pwede natin sabihin.
Kung sila, mataas ang level ng recognition and accreditation. So, wala tayong kaduda-duda. Okay, RITM.
Yun lang, sir.
Sige, ano ba? Psych wants to allow more
Yeah, kasi alam mo, I've been absent for the longest time.
Martin din, ma'am.
Sige, ano?
Sir, yung 2.25 billion for PCPs, parang early last month yung request ko sa Congress. Anong nangyayari? Anong information sa inyo? Bakit natatagalan? And yung infighting mo ba sa Congress, it's affecting palalo yung passage nito?
Hindi na COVID-19 yan fighting na yan Wala akong inside information. Alam na natin sa dyaryo, may nagpalitan ng mga chairmanship. So I don't know how that one is affecting, but we have been writing follow-up letters. Pero syempre, nagbago yung chairmanship. Pero importante naman yan, meron naman tayong pondo ngayon. Based on the guidelines by the DPF.
Sir, just to clarify, you mentioned earlier sapat pa yung budget for now. How long will it last po? Yung 530 million? Kasi di ba we're asking for 2 billion pa po. So, parang hindi po sapat pero nanghihingi pa po tayo.
Sa nanghihingi tayo dahil nga based on our allocation plan, 5,000 healthcare workers. Pero tandaan naman natin, wala naman tayong local transmission as of now. Sapat pa yung PPEs natin that we have in stock. And marami rin papasok, may papasok from WHO within this week, papasok. About siguro, yun nga lang kasi tingi-tigi eh. May 8,000 na aprons and gowns, tapos may 4,500 na N95s. So, kailangan pa yun i-repack para maging isang buong set. Because a set consists of headgear, goggles, mask, N95 mask, gloves, apron, overalls, the overalls, and then the apron, and then the shoe cover. About 6 or 7 items in one set of PPEs. So, iba-iba yung pinadadala. So, bubuin natin, i-repack natin. But of course, syempre, ang pagbibigay din natin kasi ng PPEs, risk-based. Risk-based. Ibig sabihin kung sino yung pinakamalapit dun sa mga tao talaga may sakit, yun yung kukumpleto natin yung kanilang PPEs.
Last two questions, Ma'am Sheila and Ma'am Dean. Single questions kami.
Ma'am, na-mention niyo yung 19 na nag-training sa SOCOR. Kailan sila dumating and nasa NCC sila lahat?
Dumating sila dito sa bansa noong February 21. Sila ngayon ay nasa isang referral hospital natin. Yung mga nag-exhibit ng signs and symptoms. Tapos yung iba naman, nandun sila doon sa kanilang fort. Doon sila naka-quarantine sila ngayon. Fort, yung kanilang camp.
So, military, police?
These are trainees.
Last question.
Ma'am, yung sa follow-up lang kanina, yung mga nasa NCC, kailan po yung send-off sa kanila? And pwede bang i-cover?
That's March 11, bawal i-cover. Kasi yung mga, diskutuhin natin yung privacy ng mga repatriates. You know, they don't want to be identified. So, let's respect that. Okay. So, ikaw ba repatriate, please?
Okay, so thank you very much. That concludes our regular press briefing. We will be updating the media on the next schedule, it might be tomorrow. So just be updated nila sa Viber group natin. Those who are not yet part of the Viber group, please approach Sir Dennis so that you will be added in the group. Thank you very much.
Okay, thank you very much, everyone. Thank you. Asek Musa, thank you.